Hello, and welcome to part 2 of CBT for substance use during COVID-19 crisis. This is brought to you by Beck Institute for Cognitive Behavior Therapy, and I'm Alan Miller. I'm director of CBT at Beck Institute. Beck Institute was founded in 1994 by Dr. Aaron Beck and his daughter, Dr. Judith Beck. Since that time, Beck Institute has become an international source for training, therapy, and resources in cognitive behavior therapy. The mission of Beck Institute is to improve lives worldwide through excellence in CBT. You may receive a free newsletter by going to the website beckinstitute.org/subscribe. The objective of part 2 is to identify and describe CBT techniques for helping those with substance use disorders during this pandemic. A very brief review of part 1 of the webinar was that we reviewed the current situation as defined by the COVID-19 pandemic. We talked about the efficacy of CBT for use with substance use disorders, and we talked about various treatment considerations. We defined the cognitive model and described cognitive conceptualization, and then we described the process of CBT treatment from beginning to the middle into the end. There are a few overriding considerations of treatment that warrant repeating during this second part, and that is the level of care that a person is in, the stage of change that a person is in from pre-contemplation to action, the individual circumstances, their genetics, adverse childhood experiences, their individual use history of drugs, and the individual's environment in which they grew up and in which they live in now. And then, of course, the individual's preferences in terms of their goals and their aspirations. Consideration of that, their goals and aspirations related to substance abuse might generally fall into 3 categories. One, where there is a goal of total abstinence from the use of alcohol and other drugs. Another is medication-assisted treatment. And the third is harm reduction. So in consideration of all of those, what do we consider recovery to be? So recovery would be returning a person to their highest possible level of functioning with the least amount of external support. So as people begin the reintegration process after social isolation, they're going to encounter new different kinds of problems. And I think that there are 3 top stressors that people are going to encounter. One is not new, but is going to be exacerbated by the new circumstances and the stressors that are involved in them, their urges and their cravings to use. The second one is their level of motivation, because as things change and as people are overwhelmed and are complicated by the conditions of depression and anxiety and a variety of other things in their environments, their job status, these things are going to make it increasingly more difficult for a person to have the will and the energy to get up and to want to change or continue to work on maintaining the changes that they've already made. And then the third area is interpersonal challenges, which includes the personal relationships that they have with people, friends, family, but also employers and coworkers and people in social settings, people at self-help groups, or in other agencies that provide help to them, in a whole variety of different conversations will be occurring with them. So under those 3 major categories, I've identified a number of different CBT techniques that can be useful in helping people deal with the issues under each of those 3 categories. So there's something over 20 different CBT techniques that we'll be reviewing and addressing over the next few minutes in this webinar. The first of those is a cost-benefit analysis. And the reason that I've selected this is that at the very beginning of treatment, even before you start working on urges or other things on the treatment plan, some decisions need to be made about what are the goals of treatment. And these are difficult decisions and big decisions. And sometimes people need help just in figuring out what it is they want their goal of treatment to be. So this is the kind of diagram that we use in which we would identify in regards to the decision. Should it be abstinence? Should it be medication assisted? So we would pick one of those things and ask the question, what would be the advantages of going this direction? What would be the disadvantages of going this direction? And then alternatively, what would be the advantages of not choosing that particular option? And what would be the disadvantages of not choosing that particular option? So in this example, you can see that it's laid out what would be the advantages and disadvantages of using relaxation techniques in regards to dealing with urges and cravings. And then alternatively, what would be the advantages of not using relaxation and the disadvantages of not using relaxation? A shorter form of the decision-making process is found with the technique with the acronym ITCH. Identify the problem, think about possible solution, choose a solution to implement, and then how well does it work? That is, review it afterwards to kind of assess the benefit that that particular technique or decision had for you. So an example would be a person having strong urges. The possible solutions are that they would use OxyContin or some other opioid in order to deal with the urge. Another would be use of some other medication or drug, or get a prescription for buprenorphine. Use relaxation and mindfulness to manage the urges and the cravings, or try to distract oneself away and engage oneself in another kind of activity. Choose one of those. And in this example, choosing relaxation and mindfulness, try that out for a week at the end of the week, or whatever prescribed period of time makes sense given the setting that one is in, and then follow up afterwards to see just how helpful was that. So I mentioned relaxation and mindfulness, and those clearly are useful to people in many different situations because relaxation and mindfulness can help to manage stress, can help to manage emotions, physical discomfort, manage cravings, to respond thoughtfully to stress, and it can help people to maintain the gains that they've already made. There are different techniques that fall under the general category of relaxation and mindfulness, from deep breathing, progressive muscle relaxation, visualization, mindfulness. And so a couple brief examples. This is an example of one breathing exercise, which can be done by almost anybody, almost any place. And that is, you sit in a comfortable position, you breathe in deeply through your nose for 4 seconds, you hold your lungs full for a couple of seconds, and then you breathe out for approximately 6 seconds. You continue to do that for 1 minute. And at the end of that 1 minute, we find that a person's heart rate and their blood pressure will be reduced just for doing that simple exercise for 1 minute. To make it a little bit longer and a better benefit, a combination of a breathing and a mindfulness exercise is described on this slide that you can review and use as you wish. Progressive muscle relaxation is a different kind of relaxation exercise where it alternates between tensing up the muscles in various muscle groups throughout your body. You tense them up and then you relax them very slowly, typically starting at the top of the head and working down to the feet to tighten and then release slowly to allow the muscles throughout the entire body to relax. Mindfulness is a little bit different in that it is training a person to control their attention. And that is, we bring all of our attention into the present moment so that we can control and manage our attention by doing it that way. Relaxation is not a defined goal of mindfulness, but it does tend to happen when a person is able to manage all of the thoughts that they're going on and focus their attention in one direction. This is a diffusion exercise provided by Russ Harris, which is a very popular one, leaves on the stream, and a lot of people have found this particular one to be very useful. The next technique is that of distress tolerance, because indeed, these are very stressful times for a whole variety of things, including the COVID-19 and the possibility of infection. And so managing this begins with the process of accepting that there are certain realities about the situation that we don't have any control over, we're not going to be able to change, and that we live with it with a certain amount of tranquility in spite of that. So this is very similar to the serenity prayer, where with the serenity prayer, we're looking for the serenity to accept the things that we cannot change. Of course, the courage to change the things that we can, and also the wisdom to know the difference. One of the techniques from dialectic behavior therapy accepts. So with each one of the letters in the acronym stands for an activity or some way of helping a person to come to terms with and to live in acceptance of the things that they don't have any control over, and kind of moving it in a direction of those things that a person does have control over. So each one of the things listed here is something that a person can do, and it works our mind to focus on those things that we can do. And by providing that distraction, it helps us to accept those things that we cannot do. Emotion regulation is something that's really important for people with substance use disorders, because those people who are in the early stages of recovery are going to begin experiencing emotions that they haven't felt for a long time. These are not just negative emotions, but positive emotions as well. And oftentimes people just don't know what to do with them or know how to manage them. And so one of the broad things that people can do to help to manage their emotions is developing a healthy lifestyle. And that is healthy eating, beginning to exercise at some level that they can tolerate both physically and mentally. If they haven't been exercising for a very long time, just starting off with stretching exercises and movement of any kind would be a good start, moving up to whatever they can eventually tolerate. And then, of course, sleep is one of the most underrated activities that we have in terms of its level of importance. On this slide and the next slide are a variety of suggestions that fall under the heading of sleep hygiene that are helpful to us in having a regular sleep schedule. Maintaining a regular sleep schedule along with eating and exercise together will go a long way toward regulating the emotions that we experience. So the next category of problem then that we talked about are CBT techniques for motivation. So one of the things that will be most helpful to people in terms of motivating them to do the things that they need to change or to maintain the changes that they've already made is when we can help them to attach the changed behavior to the values that they have. People tend to value those things that bring them pleasure. And I'm not talking about instant happiness, or I'm not talking about the euphoria that comes from using a drug, but true pleasure about being alive. And the things that on a longer term basis, not just on a momentary basis, on a longer term basis, that really give us pleasure about being alive and in the world today. Those things that give us a sense of achievement when we feel good about what we've done. And those things that affect meaning in our lives. So all of this comes through experiences and activities, but the meaning, the important thing about this, it is the meaning that these things of our lives to ourselves. It isn't what other people think about us. It's what we think about ourselves. And it's what we think are important things and help us to feel good about ourselves and give us a sense of accomplishment about ourselves and the meaning that we ascribe to that. We start with the values, and then we ask the question, if those values were to come to realization in our lives, what would that be? And those would be our aspirations for the future. These are the things that we would want or hope to be able to achieve or experience at some point in the future. So based on our values, we elicit those aspirations, those things that we want to realize in our lives. We imagine ourselves being there and actually doing that and having that experience. And we focus on the emotions, the positive emotions that we experience while we're there doing those things that we aspire to do. And then we develop a treatment planning process, which helps us in small increments to work step by step toward achieving that. So our goals and setting our goals with clients is comes about then by asking, how would you like your life to be different as a result of therapy? And what would you like to be doing differently? These things should be aligned with the values and the aspirations that a person wants to achieve in their lives. So we break them down into small workable pieces, as I said, and go step by step. And sometimes there's overlap between different categories or goals. We can put them together in a way that makes sense. And of course, we need to address interfering automatic thoughts, which we'll be talking about a little bit later. The next thing is, when we have our goals and our aspirations and our plan and our small steps, well, we have to sort of understand, what is a person's current level of activity? How do they spend their time now? And so we ask them to monitor their time using any kind of form that you can make up with small time intervals throughout the day, each day of the week, and over a period of a week. Ask them to keep track of what they're actually doing during each of those time intervals. We want to also know from those time at intervals, as they're tracking that, what is their mood in each one of those different situations. And we also want to pay particular attention to those things that they're doing that could be high risk situations. But we also want to know, what are those things that they have done, that they've done well, and or are pleasurable activities. So we want to increase the number of pleasurable activities, right? Keeping in mind that these are the things that people value, the things that bring pleasure to their lives. Now, people with substance use disorders oftentimes have trouble identifying what are helpful activities, because for so long the default category was getting high that they've lost track of many of the things that they used to do. And so it might take some help with them to identify what are those kinds of things that bring them pleasurable and a sense of achievement. And using Socratic questions can help them to make those connections between the activities and the mood. And when we identify those things that a person wants to be able to do, that is, that bring pleasure, bring achievement, give meaning to their lives, move them toward their aspirations in alignment with their values, then we start putting those into the schedule for the following week, and increasingly add those to the schedule, so that a person can do more things that bring pleasure and a sense of achievement and give meaning to their lives. So we schedule specific times, step by step, to increase the chances that they will actually be able to follow through and do this. So A minute ago, I mentioned automatic thoughts, and this is where the Socratic process comes to be very, very valuable for those in recovery or aiming to gain recovery. And some of the prophetic kind of beliefs that play a very important role here, they're also known as kind of stinking thinking kinds of thoughts, that I can't stay clean during isolation. I miss being out with my friends and getting high. I can't wait to see them again. You can see that how different beliefs or thoughts that a person has can be risky in terms of leading them back to using, because some of them, like the first one, refers to an intolerable situation. The second one is anticipation, and we know that anticipation of getting high gets us about halfway there. I need something like a drug to chill. That means it gives me relief, and I think that this is the only way that I can get relief. And the pandemic is exceptional. People will understand if I use during this period of time. But then on the other hand, if I have used, then people are going to reject me because I have used during this period of time. So one of the first things that we do is begin by evaluating the evidence for the thoughts. What is the evidence that the thought is true, that I need a drug in order to chill? What is the evidence that's an accurate thought? On the other hand, we want to know, what is the evidence that doesn't support that belief, that you need a drug in order to get any kind of relief? And then usually beliefs like this, I need a drug to do this, or I can't do this, one thing or the other, is based upon the evidence that only supports it. And it doesn't include the evidence that doesn't support it. So what we ask a person to do is put together all of the evidence that supports the thought, the evidence that doesn't support the thought, and come up with a new alternative belief, a new way of looking at the situation. So what if the prophetic belief does not come true? That would mean that the worst would happen. So we want to ask the question, what's the worst thing that could happen if it does not come true? And how can I cope with it? How can I cope with the situation if the worst thing does happen? What is the best that would happen if the prediction comes true? And what's most likely to happen, which is usually something that is somewhere between the worst and the best. Another way of dealing with thoughts of this sort is to ask the person, what is the effect of telling yourself this thought? What is the effect of telling yourself over and over again that you need a drug in order to get any kind of relief? What would be the effect of changing your thought about that? And if you had a friend who was dealing with this, what would you tell someone else if they were saying these kinds of things to themselves? And in consideration of all of that, what do you think that you should do now? Next technique is imagery. And this is one where we imagine ourselves being successful at some point in the future in regards to using a technique or making a change or dealing with something in some successful way. So we want to clearly state what it is we want to have happen. We imagine that that's happening right now. We imagine ourselves performing the skill in exactly the way that we hope to be able to do it. And we do it all the way through. We imagine ourselves completing it all the way to the end. And we imagine that it has gone well, and we experience that positive feeling that goes along with that success, the pleasure, the achievement. And we talk about what does that mean about us because we are able to do that, or what would that mean about us if we were able to do it in that way. And so now we go to interpersonal effectiveness, the last of the three major kind of problem areas that we're addressing in this webinar. And the purpose of interpersonal effectiveness is to make sure of several things. One is that we obtain our legitimate rights, that we're able to refuse unwanted or unreasonable requests, like from a friend who says, hey, let's go get high. How do you say no to something like that? Resolving interpersonal conflict. Again, the DBT area gives us a technique with the acronym Dear Man to help us with this. But in the first part, before we get to that, is to just talk about communication skills that are necessary. So we want to learn how to express our needs, turn down requests, stand up to critics, express positive feelings, make legitimate complaints about things with people, and to engage in difficult discussions. While we're having or engaged in any one of those activities, we want to be sure that we have a positive attitude, that our body language conveys the message that we're serious, that we're sure about what we're doing, and that we mean what we say. We maintain eye contact with the person that we're talking to. Our posture is such that we are being assertive. Our tone of voice is convincing, and we have an appropriate level of loudness. We certainly want to be heard, but we don't want to be overdoing it either. So the Dear Man technique is describing the situation and expressing the feeling or the opinion that we have about that. We want to assert ourselves into asking for what you want and saying no to those things that you don't want. We want to reinforce the other person. We want to give the other person the benefit of the doubt and express appreciation to them for listening, for understanding, and for being willing to work with us in this difficult situation. We want to be mindful, which means we want to stay present and focused on the specific things related to this specific objective. We don't want to stray from the path. We want to appear confident using the appropriate tone of voice, eye contact, posture, etc., that I mentioned a moment ago. And we need to be willing to negotiate, and that is not dig in our heels and say 100% my way or no way on some of these kinds of things. Certainly on some things we may not want to negotiate, like whether or not we want to go with somebody to get high. That might be a deal breaker. On the other hand, there might be other kinds of things that are very negotiable, and we can give as well as take from other people. One of the things that helps us in CBT, because there are lots of things that we talk about doing, and we use coping cards, which literally could be a piece of paper or an index card, or it could be a note that we write on our phones, or it could be something that we post on our refrigerators or our bathroom mirror or something like that. Usually 3 different types. An automatic thought. So what would be an adaptive response to an automatic thought? A coping strategy, and instructions to activate. So examples of each of those: for the thought, I can't stand this, an adaptive response, I've been through this before and come through it okay, is something that we would write down so that we can have that and have it accessible to us all the time, especially in those times that are difficult for us. A sample coping card, that is a breathing exercise. This is the breathing exercise that we described earlier. A sample coping card with an instruction to activate. I need to get through this for my family, remembering to keep in mind our values, our aspirations, and the things that we hope to have come to realize in our lives in the future. I need to deal with this moment right now. And that's the kind of thing that will give us the motivation to stay committed to it. We set up behavioral experiments to evaluate thoughts and beliefs through experiments. The experiments tend to be more powerful than just doing it with words in our heads. Lots of times, clients will understand something intellectually, but it still doesn't feel true to them. And behavioral experiments are especially good at helping to make it feel true in addition to just logically being true. So we help to identify a specific thought, an automatic thought or a core belief, and we use an activity to test it out, usually to confirm or disconfirm a hypothesis that we have. We keep in mind the case formulation, so we collaboratively work together to come up with something. So we provide a rationale for doing the experiment. We make a prediction. This is what will happen if I do this. So if I use the relaxation exercise, or if I use the alternative thought, my prediction would be that it would be helpful in this way. So we are very specific about what it is. So I'm going to use this thought. The next time I think about using, I'm going to take out the coping card. I'm going to look at this. I'm going to look at the coping card that says I need to get through this for my family, remind myself of those things. The prediction would be that this will help me to deal with the urge that I'm having in the moment. I record the outcome, what actually happened. And then when they come back to us, then we review it to ask the question, how well it worked. One of the things that's important is to ask how likely it is that they're actually going to complete the plan. And if they tell us anything less than 90%, then it's really going to be questionable about whether or not they will do it. And so we want to redesign the plan until they say, yes, now this design, I'm 90% certain that I can do this. And then we go into the final part of this, which is the action plan. And this is the assignment that a person will have to work on between our sessions with them. So they're going to practice on this. And what they do in between the sessions is going to be a significant indicator in terms of what the ultimate outcome of treatment will be. So we're going to generate action plans. We want to tailor this to the individual client. We want to provide a rationale, develop it collaboratively. We want to consider starting the assignment in the session so that they understand exactly what to do and how to do it. And we're going to plan for completing the assignment, where they're going to do it, when, visual prompts, reminders. And then as challenges come up for them while they're trying to perform the action plan, what are things that they're going to do to try to offset those challenges? So in summary, what we've done is talked about 3 different kinds of problem areas that we anticipate people having as the social isolation relaxes and as people reintegrate into social situations, dealing with urges, low motivation, interpersonal problems. We talked about the overriding benefits of things like coping cards, behavioral experiments, cognitive restructuring, and action plans, and put all together, there's a package here of 20-some CBT treatment techniques that can be used to help people as they reintegrate into social settings following social isolation as they deal with the COVID-19 crisis. So I hope that you have found something here that is useful or something that you can try out. And I hope that you and your clients will have benefited from this in some way. Otherwise, I wish you well, and I thank you for listening into this webinar.